Hello everyone. In this video we will be focusing on a common injury that average individuals and athletes have. It is a dislocation that occurs in the patella, which is more commonly known as the kneecap. The patella or kneecap is that triangular knobbly bone that sticks out on the front of your knee. It lies on top of the knee joint between the femur, the thigh bone, and the tibia, the shin bone. So when we look at the knee joint, we will see that the patella is embedded beneath the patellar tendon, which makes it a sesamoid bone. The quadricep muscles extend down the femur and is attached to the top of the patella through the quadriceps tendon, and the patellar tendon attaches the patella to the top of the tibia. The patella lies in the patellofemoral groove, which enables the bone to glide vertically during movement. The patella essentially works together with the quadricep muscles as a lever to extend and flex the knee. A patella dislocation occurs when the patella slides out of position in the patellofemoral groove. It can also only partially dislocate, meaning it partially moves out of place, but this is called a subluxation. Typically, the dislocation happens laterally from its original correct position in the groove on the knee. This means the patella slides around the outside of the knee when it's supposed to only move up and down. The patella will slip outside of the groove and be pushed to the bony head of the femur, known as the lateral femoral condyle. The dislocation of the patella can happen in several ways, from direct trauma to the knee, to sudden movement, or from naturally occurring conditions that place pressure on the knee joint. An instance of direct trauma would be a motor vehicle accident where the patient's knee hits the dashboard and the impact pushes the kneecap out of place. Most of the time it occurs during sudden movement, when the individual trips or falls and the kneecap is forced out of place. In sports, it happens when athletes are moving at high speeds in one direction, and they abruptly change direction with their leg planted on the ground, which twists the knee and causes the patella to dislocate. There are also naturally occurring or pre-existing conditions that might predispose people to have a dislocated kneecap. One of them are weak quad muscles. The vastus medialis obliquus muscle, or VMO for short, is one of the 4 quad muscles on the inside of the thigh and is responsible for maintaining the position and stability of the patella towards the inside of the knee. If the VMO muscle is not strong enough, excessive pressure is placed on the patella, pushing it outwards and causing dislocation. Overpronation of the feet is another pre-existing condition. This happens when the foot is rolled in too much while standing or running, which shifts the weight to the inside of the sole, causing the leg to turn inwards. This puts pressure on the knee joint and is another factor of patellar dislocation. Complications of the injury. Pain will be felt immediately at the time of injury on the front side of the knee and under the kneecap. The knee region will feel hot and become swollen and stiff, and in some cases the leg may be stuck in a bent position, making it impossible to stand. There will also be a visible deformity of the knee, where the patella is obviously shifted towards the outside of the knee. Some may experience numbness and immobility of the foot, but this points to nerve damage caused by the dislocation, which is possible but rare. But in many cases, however, a dislocation of the kneecap causes irreparable damage to the cartilage surface of the patella. Microscopic fractures of patella bone will be present, and these tiny fragments of bone may lock the knee joint and cause further damage to the cartilage. Suffering a patellar dislocation will also place patients at a high risk of getting knee joint arthritis in the future. The good news is that in most cases, the patella returns to its correct position on the patellofemoral groove spontaneously, and even if it does not correct itself, a medical professional should find no trouble easing it back into place manually. Recovery times vary depending on the severity of the injury. If cartilage or bone damage was sustained during the injury, surgery will be required and the patient will need to spend more time in physiotherapy. But all in all, it usually takes about 6 to 9 weeks to fully recover from a dislocated kneecap, and it takes longer to return to sports or other strenuous activities. Physical therapy is an important part of the rehabilitation process to strengthen the muscles of the thigh so that the kneecap stays in alignment. A typical physiotherapy program for a dislocated kneecap will aim to do the following: reduce pain and inflammation, normalize joint range of motion, strengthening the knee, especially the quadriceps muscles, strengthening the lower limb, which includes the calves, hip, and pelvic muscles, improving patellofemoral alignment, improving agility, balance, and knee function, which includes walking, running, squatting, hopping, and landing, and finally, minimizing the chances of redislocation. These are some examples of typical exercises to strengthen the muscles that stabilize the patella. The first one is called the static quadriceps exercise. The patient should sit upright with their leg stretched out in front of them and a towel placed under the knee. Then push the knee down into the towel so as to tighten the front thigh muscles or the quadriceps. The patient should feel the tightening of the muscle by putting their fingers on the inner quadriceps, and the process should be repeated 10 times after holding for 5 seconds. The next exercise is the adductor squeeze exercise, and this is done lying down with a Pilates ball placed in the middle of the knees. The knees are then straightened to tighten the thigh muscles or the quads, and the ball between the knees should be slowly squeezed to tighten the inner thigh muscles, the adductors. This is also repeated 10 times after holding each round for 5 seconds. The bending knee exercise is just a simple exercise that can be done lying down. The patient straightens and bends the knee as much as the knee will allow without pain. Movement can be gradually increased over time until the full range of motion is restored to the knee joint. This should be repeated 15 to 20 times. These exercises can also be done as preventive measures to avoid dislocating the kneecap. That is all for today. Thank you for watching.